Now, friends and family of a Kent teenager who died after experimenting with drugs have joined forces to campaign for better drugs education in schools. Back in 1993, there were 110 drug-related deaths in the southeast. By 2013, that number had increased to 269. But last year, the figure was higher still. There were 364 deaths in the region. Well, Kim Webster's son, Will, was just 17 when he died 4 years ago. It's had a lasting impact on his friends at Canterbury College, who've told our reporter Lucinda Adam that they're supporting his mum's campaign to try to prevent other tragedies.
Let me just educate you lot real quick. This is Will Hawley. Sadly, in 2018, Will Hawley went out with one of his mates and they both took the same amount of drugs, but Will died. But if you could sit down and have a 10-minute conversation with me, his mum, any other of his friends, I promise you you'd never touch drugs again. Will's friend
Speaking from the heart about the friend he lost. Charlie was one of Will Hawley's best friends. They shared a love of boxing. Now campaigning alongside Will's mum, Kim, he wants to see a change in how drugs awareness is taught in schools.
It's clear that the conventional drugs education system isn't working if there's an increase in drug deaths in youths. And so there has to be some kind of reform in the education system around drugs awareness.
Will's mum, Kim, is using her personal tragedy to try to do things differently, going into schools in Kent to tell teenagers the impact her son's death has had on her.
It's emotional, it's powerful, and the children listen. There's one that I do hear lots of gasps because I talk about my PTSD and the reoccurring nightmare that wakes me up, and I'm in that hospital room with Will and I'm rubbing his ears because they're turning blue. That's really hits home.
Had a little argument.
Working with the Kenward Trust Rehab Centre in Yalding, they've created a video and lesson plans for teachers. But they want more of the £780 million the government has pledged to combat drug and alcohol use to go towards supporting schools.
I think it's really important that not just the investment that they have made in addiction services and supporting rehabs like Kenward Trust to help people with addiction issues, but also investing in education.
Current rules only require schools to provide 1 hour of drug education during a child's time at secondary school, and it isn't mandatory at colleges or universities.
This is a huge problem because what we've seen in the UK is drug-related deaths at an all-time high. We've seen children using illegal drugs such as Xanax and lean. Benzodiazepines are on the increase amongst young people. And to further compound this issue, we're seeing more young people turn to social media to get reliable drugs education information.
In a statement, the Department for Education said teaching about the risks of drugs is part of compulsory health education, and they've worked with experts to make sure high-quality teaching resources are available. But Will's family and friends want more funding to take their face-to-face message to more schools. Lucinda Adam, BBC South East Today, Yalding.
We just heard from Penny Williams of the Kenward Trust in Lucinda's report, and she joins me now in the studio. Thanks for taking the time to come and talk to us. Bearing in mind it's the start of the new school term in a matter of weeks. Is it as simple as increasing the amount of time spent in school teaching children about drugs?
I think it is that, but it's also then using support video and lesson plans that Kenward Trust has now sent out to over 160 schools in Kent. So it's actually the quality as well as the time to actually engage with young people and really lay out what you leave behind if you make some bad decisions with drugs and alcohol.
I suppose the big change over the last few decades is the internet, not only because of, as you mentioned, the videos. I mean, that can be used in a great way, can't it, in terms of targeting, but also the drugs that children are exposed to when they go online. And I suppose schools and parents just don't know what their children are doing a lot of the time.
No, and I think that's been accelerated by the pandemic. So mental health issues have accelerated, which we're quite aware of with young people. You know, that cohort now have had so many challenges with their schooling, their exams, etc. And the internet has been their friend during those times of lockdown and isolation. So they have been easy to then find these sorts of ways of escaping and the ability to get hold of drugs very quickly.
And in Will's case, it was obviously, as we just saw in Lucinda's report, another child took the same drugs, nothing happened. You know, there were no untoward effects. I mean, it is a lottery, isn't it?
It is a total lottery, and it's got several levels. That, you know, prescribed drugs by a GP doesn't mean that it's going to work for you. It's dangerous to take those, and we found that that's quite shocking that people don't understand that. And then secondly, yes, the desire to just buy anything off the internet and not really know what you're taking is quite shocking too.
Now, clearly, Will's mum's doing great work, as are his friends, as are you as a charity. Are you in dialogue with government, with the powers that be, about getting some of this messaging, some of the things you're asking for, down to schools?
Well, we did write to the Prime Minister before the lockdowns, but obviously that sort of fell by the wayside. So it's something that we are talking to as many people that will listen, MPs, KCC, etc., to see if we can get more funding and more support for this campaign.
OK, Penny Williams, thanks ever so much
you
for coming in and talking to us on the programme. And if you have been affected by any of the issues we've just been discussing, there is help available on the BBC Action Line. Just go to our website, bbc.co.uk/action line, or you can call 0800 066 066.